Yeah, thank you for joining me. My name is Dr. Catherine Taketa-Wong, and I'm a naturopathic physician and an acupuncturist. And for those of you who aren't familiar with naturopathic physicians, so like medical doctors, we have to attend a four-year medical school. We're trained as primary care physicians, and as such, I can order lab tests, I can write prescriptions and do school physicals just like other doctors. But a big difference is that we're really trained in the power of nutrition to build health from the inside. And I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before we begin, I just wanted to let you know that if you have health concerns that you would like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. So this is a 15-minute strategy session where we talk about your condition and come up with a plan to see how I can help you the most. So arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in the Personal Health Strategy Session or the no-charge phone consultation. So also before, when we are in the Facebook Live, if you have questions or comments, then you can feel free to use the comment section to ask any questions or comments as the talk progresses. So, and hello to all of you who are joining us. Hello, Donna. So today we're going to be talking about additives in our chemicals and in our water as well. So a lot of these things are things that there's not much awareness about. And the US regulations allow more than 10,000 chemicals to be used in food and in materials that come in contact with our food. So let's stop and think about that for a moment. Did you know that many chemicals are allowed in our bodies? And can you name, say, 5 of them? Do you know what harm they can cause? So unfortunately, it takes a lot of work with reading labels to know what these chemicals are, and that it takes good knowledge of science to understand how they can affect our health. So what's especially worrisome is that they can affect children even more than adults because of their developing organ systems and their lower body weight. So that's why I decided to educate you a little bit about many of these different chemicals that we see that are occurring. So I'm going to go through several of these different chemicals, and then we'll talk about some of those and where you can find some of those different chemicals. So one of those is, one of the first ones I wanted to start out with is something called bisphenol A, or it's also called BPA. The research has found that bisphenol A has been linked to a number of different conditions. Bisphenol A has been linked to higher incidences of autism. Also, it's linked to high blood pressure. Has been found to be associated with reproductive conditions. So in animal models, research specifically linked it to infertility, early puberty, increased risk of reproductive cancers, and then low sperm count as well. BPA has also been linked to asthma, as well as obesity and breast cancer. So there are mounting evidences that exposure during pregnancy to BPA can lead to negative outcomes as well in the children, not just the mother. So prenatal BPA exposure has been linked in research to aggression in 2-year-olds, as well as anxiety, depression, and poor emotional control in girls. And it has been found that BPA will cross the placenta. So when a mother is getting exposed to BPA, it is crossing the placenta and baby is getting exposed to it. And it has been found in breast milk as well. And BPA has been found in newborn babies. So it is known that it does cross the placenta, and then BPA will be transmitted through breast milk. So particularly when women are before they're pregnant and then during pregnancy, really, really need to take care to avoid bisphenol A. But I mean, it should be avoided as much as possible anyway. So BPA, where can you find BPA or bisphenol A? So it's used in many different products to harden plastics. And so bisphenol A has been found in the can lining of canned goods. It's also present in plastic bottles and plastic wrap. Also soda cans contain bisphenol A, coffee pots. So these are the plastic coffee pots. Also in plastic and paper cups, dental sealants, and then cash register receipts. So BPA is the kind of the coating on those receipts that leaves a filmy feeling on them. So basically what you want to try to do in order to avoid getting exposure to bisphenol A is trying to avoid a lot of these things. So I recommend that people try to avoid canned goods as much as possible. I know for when you're looking at food storage, I mean, a lot of times there can be canned goods, and it's difficult oftentimes to avoid. But specifically with the canned goods, I usually recommend, if possible, that people try to get maybe dehydrated foods, or that they try to get foods that are not soaked in a liquid in a can. There are some types of cans that do not use BPA. However, there are concerns in terms of some of the other types of things, because there are concerns with some of the things that are used to replace BPA. There are other types of bisphenols, like bisphenol S, that is used in BPA-free products. And research has found, according to the National Academy of Sciences, that bisphenol S has been found to be just as harmful in terms of affecting neurodevelopment. So the take-home message is really that you want to try to avoid things that could have BPA. So trying to avoid the cans, if at all possible. Like I said, you can get foods that will last for a while in glass jars, or dehydrated foods where at least it's not soaking in liquids. Most foods are still packaged in plastic, so it's really hard to get away from. But one thing that will cause more BPA to leach into the foods is if there is heat that's being exposed to them. So you definitely don't want to heat anything as much as possible in plastic containers or plastic wrap. Also the coffee pots, because the coffee pots will use, of course, they're heated when they're making coffee. So those are things that you want to try to avoid. So let me see. So some of the things that, to look for in terms of other things you can do to avoid BPA. So avoiding plastic wrap. I usually encourage people, rather than using plastic wrap, trying to use stainless steel containers or glass food containers, trying to phase out Tupperware, plastic Tupperwares from your home as much as possible, and trying to use glass or stainless steel. If you have young ones like I do, then often stainless steel is a better option because it's not going to break and shatter like glass will. So that's something that you can look at. And other kinds of things that we want to look at in terms of BPA are really looking also at dental sealants. So there are the white fillings that are used in dental sealants, or in some of the fillings. And so you can ask your dentist if it's BPA free, or just trying to use a green dentist that doesn't use that uses fillings that don't contain BPA. I already recommend that people avoid the silver fillings, which contain mercury. So avoiding those, because some of the mercury, as you chew, will get into the system. So I do recommend avoiding the again the silver fillings, which contain mercury, but then also if you're going to use like the white fillings, the tooth-colored fillings. They have porcelain fillings, or you can use dental fillings that are BPA free. Trying to avoid plastic or paper cups wherever possible, and just trying again to carry on either like a stainless steel or glass water bottle. And then those plastic bottles, I really recommend that people try to avoid using those as much as possible. And again, using stainless steel or glass containers. And in terms of cash register receipts, trying to avoid contact with them as much as possible. If you don't need to get a receipt, then try not to get it. And then also, if you can just wash your hands as soon as possible after you handle them, definitely before you eat, making sure to wash your hands. So the next one that I want to move on to are phthalates. So phthalates are toxins that are used, again, to make plastics more flexible and harder to break. So they're often called plasticizers. So phthalates are used in a number of different agents. So they're used in hundreds of products, anything from vinyl flooring to adhesives, detergents, lubricating oils, automotive plastics, plastic clothes like raincoats, and then also in personal care products, so soaps, shampoos, hairsprays, nail polishes. Phthalates are often also used in some of the drugs as well, whereas particularly with some of the capsules or extended release type of things. Those are things that are used. So that's one of the things that you want to try to avoid. So again, trying to avoid plastics as much as possible. And what are some of the specific concerns, in terms of phthalates? So it's been associated with a number of different health concerns, but there are concerns in terms of phthalates, and some of the concerns are with damage to liver, kidney, lungs, and then the reproductive system, particularly when the reproductive system is developing, so in childhood and then in puberty. Some of those things can be particularly concerning. So again, trying to avoid those things. Looking up, in terms of a lot of personal care products, so everything again from, soaps and shampoos and cosmetics and hairsprays, reading the labels, looking at the ingredients, making sure that it doesn't have phthalates in them. And then phthalates, they're spelled PHTHALATES. So it's something that is, it's not always particularly clear in terms of how to spell that. But again, trying to use the plastics, trying to avoid the plastics, trying to make sure that the products that you use don't have phthalates. And also looking at particularly some products like cosmetics or things like that. So there are places where you can look at some of the different products. So the FDA has some information on the cosmetic products. And then also the Environmental Working Group has some good information. So if you just look up Environmental Working Group, they have a lot of really good information on not just phthalates and BPA, but just all these different toxins in cosmetic products and body care products. So they're a really good source of information to look for in terms of trying to look for products that don't have these toxins in them. So some of the other things that I want to talk about, artificial food colors. So my son right now is preschool age, and we look at the food products that are marketed for children his age, and these artificial dyes are everywhere. And so in terms of the health effects, there are some some types of the dyes, some of the red dyes and yellow dyes that were used in the past were associated with certain types of cancers. Those were supposed to have been phased out. There are still questions about whether some of those dyes are still used in some products. But the newer dyes are supposed to be healthier, or not supposed to be linked with cancer. But I usually just recommend just trying to avoid artificial dyes anyway. And one thing that has been associated with it is that it has been linked with ADHD, or attention deficit hyperactivity disorder, and also with more difficulty with focus and attention in general. So it certainly doesn't affect every single person in terms of artificial dyes and colors, but I certainly see a number of children in my patient population that they clearly are affected. And parents will report that, wow, after they had gummy bears with artificial dye, like they got, I've seen some children actually get aggressive. Other children just become extremely hyperactive, or just the parents say they clearly had a lot more difficulty focusing. Or if they went to a birthday party where there was cake, where there was artificial dyes or cookies with dyes in them, that those were problematic. So, so those are things, of course, that that you want to try to avoid. And again, they're in all kinds of food products, especially you look at the candies and all of these different things. A lot of them have artificial colors in them, and it'll usually say red dye number 40, or something like that. So again, trying to avoid things with artificial colors, and trying to use things that just don't have them, or that use natural natural coloring agents. So you can sometimes, for example, like beets. Beets are used. So beets are used often for like a red, to use as like a red type of food coloring. So so those are things to look for. And so again, just trying to avoid those. And then particularly if you know that you are sensitive to dyes, looking at the drugs that you're taking, because many pharmaceutical medications use these artificial dyes. So that's something that you really want to look at in terms of trying to avoid those, particularly if you know that that's an issue for you. So another thing, another toxin that I'd like to talk about is something called PFCs. PFC, that stands for perfluorinated compounds. They're abbreviated often as PFC. So P is in Peter, F is in Frank, C is in Charlie. And perfluorinated compounds are found in many different products, particularly if they're trying to convey some type of water resistant type of property to it. So perfluorinated compounds are often used in nonstick pans. They're also present in car wax and waterproof jackets. They're used in cookware, stain resistant or water resistant carpeting, food packaging, as well as electronics. And so, so these perfluorinated compounds, so what are some of the risks with these? So there has been one report that's found that there is an association of PFCs, or perfluorinated compounds, with osteoarthritis in women. There's another study that finds an association with poorer quality of semen in men with exposure to perfluorinated compounds. And then there's another study that found an association with asthma in children with PFCs. So looking at all of these things, what can we do to avoid these? So nonstick pans, definitely anything that you can consume where you're clearly ingesting it into your body is the highest priority. So this would include basically like the Teflon type of nonstick pans. So in terms of your cookware, instead of, so trying to avoid, these compounds that have Teflon on your nonstick pans, and then instead using things like glass pans or cookware or stainless steel, or other things that you can look at are things like the ceramic cookware, cast iron cookware, and basically the types of cookware that were present before we had a lot of the newer technologies where they had Teflon and things like that. So so trying to avoid those. Now it can be hard because, like I said, a lot of carpeting, like stain resistant carpeting, and waterproof jackets and things like these are coated with PFCs, and so that can be difficult. But looking up the manufacturer, and again, Environmental Working Group is a good source for some of the information in terms of finding products that don't use the PFCs. So so trying to avoid those kind of things as much as possible. Trying to find carpeting or cookware that doesn't use PFCs, and also looking at food packaging, electronics. So particularly when the food packaging is something that is used where you have it in where it's in direct contact with the food, or if it's being heated, then that will release more of the PFCs. So again, it is used in a number of, like I said, some of these water resistant type of packaging. So again, trying to avoid those. And if you're, it's generally pretty safe, again, if you're using products that come in glass, food products that come in glass, because then they don't have any of these types of coatings on them. So, and then a few other things. One other thing is nitrates. So nitrates are things that are present primarily in processed meats. So a lot of sausages, and for those of you here in Hawaii, I know that a lot of people in Hawaii love Portuguese sausage and Vienna sausage. So I do say I'm sorry, but a lot of them most of them will contain nitrates. So nitrates are basically compounds that are added to food to enhance either the color or the flavor of foods. And so primarily a lot of them are in processed meats. So they are processed, found, like I said, in like deli or cold cut meats. They can be present in ham or bacon, sausages, hot dogs, and then wieners, and also in like Vienna sausage and Portuguese sausage. So the main association with nitrates are the increased risk of colon cancer. So nitrates have definitely been associated with a higher risk for colon cancer. There's also some concerns in some research studies of higher risk of stomach cancer and other types of issues with the gastrointestinal tract. But the main clear association is that there's very strong research showing that there's evidence of increased risk of colon cancer. So avoiding the processed meats is the main thing. So nitrates will show up on the labels, usually as sodium nitrate, or it may also show up on the label as potassium nitrate. So reading labels, because you can get deli sliced meats or sausages or things like that that don't contain nitrates. So looking for those And often if it says smoked or cured, then often those do contain nitrates. So trying to avoid foods that are smoked or cured, unless it says naturally cured with salt only. So, looking to try to replace these kind of processed meats in your diet and just getting either more fresh or non-processed meats. So just getting fresh, for example, poultry or beef or lamb or other kinds of things that are not processed. And then just trying to decrease the intake of meat and going for more fruits and vegetables instead. So and so there's different opinions, of course, on being vegetarian. There are some medical conditions where there are difficulties with people getting enough of certain nutrients if they have certain metabolic conditions or other kinds of things. And for those patients, or if they have severe iron deficiency, I usually still will recommend eating meats, but basically just trying to avoid more of the processed meats and doing things like lamb or bacon that are organic. But in general, I think that most Americans tend to eat too much meat in general, and just trying to really increase your intake of fresh fruits and vegetables. That can be very helpful. And also looking at vegetarian options. So not that, people have to go entirely vegetarian, but there are a lot of very healthy vegetarian meals where you can use things like beans or nuts or seeds or things like that, where you don't have to depend so much on the meats. And so those are things that you want to look at in terms of avoiding. So and then one more thing that I want to talk about is something that's called perchlorate. So that's spelled Perchlorate. So perchlorates are used in several different kinds of things. They're used in propellants, so things like hairsprays or roach spray or insect sprays or any kind of thing that is a spray. There are some types of sprays that use only compressed air where they don't use perchlorates as a propellant. So again, it's really about reading labels and looking at these kinds of things. But looking at your hairsprays and other sprays that you have around the house, there are disinfectant sprays and things like that. So perchlorate has been associated with several different things. It has clearly been associated in research with hypothyroidism, or where the thyroid gland is not producing enough of the thyroid hormone, or where there are problems with that. Perchlorates, they've also been associated with sometimes with issues if there is a high exposure. There have been associations with perchlorates with toxicity to the lungs, particularly if perchlorates are inhaled. So again, if someone is around a lot of these propellants and sprays that are used all the time, some studies do suggest that perchlorate can have toxic effects on the lungs. There have been some associations in the past with when people were exposed to extremely high amounts of perchlorate. For example, in the early 1960s, potassium perchlorate was used to treat Graves' disease. But then they found that using it in high amounts was actually associated with the development of something called aplastic anemia, where that's a condition where the bone marrow is supposed to make all of our blood cells. But in aplastic anemia, what's happening is that the bone marrow is not producing those blood cells in sufficient amounts. And so, again, this is with very high doses of perchlorates when it was used as a medicine. But it has been something that is a concern, when it was used in high amounts. So where are some other sources besides propellants that we can be exposed to perchlorates? We can also be exposed to perchlorates. It is used, there are some concerns with perchlorates in drinking water. According to the Environmental Protection Agency, there were some amounts of perchlorate that were detected in drinking water as well as in groundwater in about 26 states in the United States. So there are concerns in terms of perchlorates in the water. So that's something that, basically you want to have a really good water filter that can be able to filter out perchlorates as well as a lot of other things. And perchlorates are also present in some fertilizers as well. And so those are some things that looking at trying to use more natural types of fertilizers. So, using things like composting or worms where they'll produce natural fertilizers rather than using commercially available fertilizers that may contain perchlorates. So again, reading labels and looking at those kinds of things. So this is just a very short sampling of, a number of these things. And, so again, we want to just try to reiterate some of the take-home messages. So, we've talked about a number of these different toxins. We talked about bisphenol A. We talked about phthalates. We talked about artificial food colors. We talked about nitrates. We talked about perfluorinated compounds or PFCs and also perchlorate. So there are a number of other toxins that I don't have enough time to cover all of them, but just some take-home messages in terms of what can we do to lessen the risk for ourselves and for our children. So definitely trying to phase out plastics as much as possible, trying to eat fresh fruits and vegetables, or fresh being the best choice, trying to avoid canned products. And, I found it's really hard to avoid plastic altogether if you live in the modern world. But if you buy products that are stored in plastics, trying to transition them out, move them out of a plastic bag as soon as possible, and, transfer them into stainless steel or glass containers. And also making sure that you definitely don't heat anything in plastics at all. That's a big, big no-no. But just trying to use more of the stainless steel or glass containers, reducing the use of plastic wrap, and some other things like I talked about, looking up environmental working group and looking for products that don't contain a lot of these toxins, whether it be hair products or trying to find organic bedding or carpets or other things that don't have some of these toxins. So again, I just want to thank you for being here. I appreciate the opportunity to let you know about the dangers of a lot of chemical additives in our food and water and packaging. So again, just wanted to let you know that if you would like to talk with me personally about any of these health conditions, there are some ways that we can try to get that we can both test for these compounds in the body as well as trying to get them out of the body. So there are some compounds that are very difficult to get out of the body, but there are some things that we can do to try to avoid and try to reduce the risk in terms of a lot of these different health conditions and treating a lot of these health conditions that I mentioned. So if you want to talk with me personally about any of these things, just call our office, 808-425-2987, and then just let them know that you're interested in arranging a no-charge phone consultation. And you'll also find the contact information here on our Facebook page. Okay, mahalo, and see you in 2 weeks. Aloha.